Welcome to another episode of Well-Adjusted Mama. This is a podcast dedicated to educating and empowering women from preconception, pregnancy, birth, and through early motherhood on wellness lifestyle. I'm your host, Dr. Laura Brayton. I'm a maternity pediatric chiropractor and mother who has hand-selected experts in natural holistic healthcare specialties to shine light on options and choices during this exciting phase of a woman's life. And today I had the pleasure of having a special guest, Dr. Nelli Gluzman, back for round 2 on Well-Adjusted Mama. Today's topic was focusing on tiny tummies, big decisions, holistic insights into infant feeding. Dr. Nelli Gluzman is a board-certified pediatrician and the founder of Blossom Pediatrics, which is the first holistic pediatric practice on the East Coast. Dr. Gluzman's goal is to help children live happy, healthy lives by combining traditional wisdom with evidence-based functional medicine. She has over 10 years of experience and uses a holistic, functional, and integrative approach to medicine. Her specialty is reversing eczema, allergies, and asthma by focusing on the root cause of the issue. She received her medical degree from the New York College of Osteopathic Medicine and completed her pediatric residency at Jersey Shore University Medical Center. Dr. Gluzman is also a clinical preceptor, teaching medical students and resident physicians, and a medical consultant for Google Search. She is a guest speaker for NBC and Buzzfeed and founded Bright Illusion Thinking, where she writes evidence-based medical research content. Outside of work, Dr. Gluzman is a yoga practitioner, tea lover, sunshine enthusiast, and enjoys training her pup. She's also a proud mom, and her daughter's health journey inspired her to create a holistic pediatric practice. For more information, check out her website at blossompediatrics.com. Hi, Dr. Gluzman. Welcome to the show. It's exciting to have you back on for round 2 of Well-Adjusted Mama.
Thank you so much for having me back again. It's such a pleasure to always connect with you about these topics, and I'm a huge fan of your show. And so it's a really great honor to be back the second time. Thank you.
It is. Thank you. So we've been able to connect a lot more over the past few years since our first podcast interview, because now you are working out of the same space as me. So we get to see each other on a regular basis and really, share a like-minded thought process around helping children optimally develop. And I think that's really what I want to focus on today, is that first year of life, about what's going on with a child's development, specifically around their gastrointestinal system and their gut, how the microbiome plays a part, and how food plays a part in that development as well. So today's topic is tiny tummies, big decisions. And we're going to talk about the holistic insights for infant feeding. And so parents understand that there are options out there that they can be really proactive in helping their child grow a healthy gut, and really what that means for prevention for a lot of symptoms that you see in your practice with asthma, allergies, and eczema that are traditionally related to having issues in the gut.
Not just, prevention, of course, but also because eczema, asthma, allergies, this atopic triad, we call it in medicine, is an epidemic of chronic childhood illness, right? It's part of a bigger problem. And so many kids are suffering from eczema, asthma, and allergies. The numbers have been skyrocketing. Every year, it's more and more and more children and young adults that have developed eczema, asthma, allergies, and it's not something that they're outgrowing anymore, turning into adults with these problems. And so I'm seeing so many of these kids in my holistic pediatric practice because it's a reflection of how many kids are suffering from these issues and how very limited the resources to heal these chronic problems are in the conventional medicine realm.
Right. And to your point, these are really chronic issues here. This isn't like, seasonal allergies, I'm suffering, which is still not okay. But in other words, it's not coming and going. It's ongoing. It's consistent. It's for year after year. And they're not, to your point, outgrowing these symptoms. And so it's really could potentially be lifelong, right? Unless parents are educated about how they can intervene and shift this. And I think there's a lot of hope here with this podcast episode, because I want parents listening to know if your child does have these symptoms, they don't have to have them for the rest of their life. There is things that can be done with their lifestyle to help the body heal and detox and resolve permanently asthma, allergies, and eczema, because it's not normal. And it's an indication that there is something creating inflammation in the body. So can you speak a little bit to why it is skyrocketing? Like, why is this happening?
Great question. And I think we could talk about this as to why for hours and hours and hours. I certainly can. And so I'm just going to kind of say this is a multifactorial problem. It's coming from different directions. Of course, there is a genetic predisposition, as all things are. And then there's all the environmental things that we as parents do have control over. So there's what your child is exposed to in their environment, what your child is able to detox naturally. There are natural ways of getting rid of the inflammation in their body. There's really, it all comes down to what you can control and what you can't control when it comes to development of any chronic problem. And I just want to say, like, what is a chronic problem when it comes to eczema, asthma, and allergies? How do you know if you really need to intervene beyond the regular symptom management? And those symptom management tools that we have in conventional medicine, like albuterol inhalers for your child who's wheezing, that's a life-saving medicine. Of course, it is absolutely necessary when it's necessary. Or a child that's really suffering from seasonal allergies, they might need to be on some kind of conventional medicine short term so they can sleep, so they can go to school, they can be feeling okay. For the kids who have eczema over and over again, of course, you might need to use topical steroids to calm that inflammation. All of these treatments, they work, they're life-saving, and they're an excellent bridge to help you get through that tough time so that you can function as a family, so your child can feel better. But if you're needing to rely on these symptom management tools over and over and over again, where you're having the same problem every season, every winter, every spring, every time your child eats certain foods, every time they're exposed to something, the weather changes, whatever that may be, every time they get a cold, they need to rely more and more and more on these medicines that just treat symptoms. Then you have to address the root cause of the problem. And the root
And this
cause
could be over-the-counter medications too, right? Which I think people sometimes feel are harmless, but they're chemicals and they have side effects as well.
So it's absolutely, and just because it's so common, and how many of you parents listening right now can relate, like, well, I have allergies, my sister has allergies, my neighbor has allergies, everyone has allergies, everyone is coughing, sneezing. Right now we're recording in the spring, so it's
right.
Everyone sneezing, coughing, runny
Oh,
nose.
the pollen count's really high.
But just because everyone seems to have allergies right now does not mean that this is a normal process. It's really a newer issue in society, and because you can get these medicines over the counter to control the symptoms doesn't mean that it's a normal process. It means that there's too much inflammation in the body and the immune system is overreacting to normal things in the environment, because there's nothing wrong with grasses and trees and pollens and beautiful flowers and dogs and cats and all these amazing foods. That's not the problem. The problem is how our immune system is responding to all of the components that are in the air. So in the air, in the foods we eat, etc. So I kind of deviated, but I'm going to bring it back to why is this happening? It's multiple different reasons. It's not just genetics, which is a good thing, because there's so much parents can do early on, and it's never too late to start reversing these problems at the root cause. And most of the problem lies, or at least in for most kids, it lies in optimizing gut health.
Yes, that's right. So there is a lot of empowerment here because genetics play such a small piece, like maybe 10, 15%, right? It's the epigenetics, it's our environment, it's our lifestyle, it's things that we can control. And to your point, even if, a child is growing up eating the best foods and, clean, low toxin environment with cleaning products and skincare, they can still have these issues if that first year of life was not optimized for their gut development, right? So let's talk about what that looks like. When a baby is born, what is going on with their gut and what happens with the normal development that first year?
So there is most of the studies are pointing to the fact that babies' microbiomes in their guts, because the microbiome is all the bacteria, the viruses, the fungus, all the organisms that are around us and in us and every part of us. There are actually more cells that are not human in a human body than there are human cells. And that is completely normal as long as, and helpful, as long as that microbiome is healthy and diverse and the right kinds. So at birth, the gut microbiome and is mostly, largely, not completely, but mostly absent at birth. There's so much emerging evidence and studies that are done on this topic, which is a wonderful thing because this is really where we need to focus on if we want to reverse this chronic problem for society. Initial colonization, like the microbes that just start to come into the gut, are really done during birth. Okay, that first gulp that your child takes through the birth canal is what they're going to be colonized with mostly, and that's a normal natural process. But when you have kids who are born by C-section, their first gulp is not the same as the first gulp, that the first vaginal flora colonization. And so the microbes that are seated in the gut are going to look different. And we know this. It's really easy to study. This is a fact, that initial colonization of microbes will probably be the skin flora because everyone's touching the baby and kissing the baby and touching the baby, and whoever's touching the baby in the first few days of life, that's what they're going to be colonized with, more than the microbiome that might be most beneficial to them. So this is kind of where it begins for many kids. Not all, and it's not their lifelong destiny. It could neutralize, it could equalize, but about 30% of deliveries right now are C-sections. So that's something to note in the US.
Exactly. And I also want to mention that genetically, that baby prefers the microbes of mom and dad, right? Like that's the type of bacteria and flora that work best with their genetics. So vaginal flora from mom, skin on skin time with mom and dad after birth help to create that.
Right. And then there's breastfeeding, right? Breast milk is not just the best nutrition for a baby. It also contains beneficial bacteria and a really rich supply of prebiotics. That's the food for the healthy microbes. They're called oligosaccharides that are the prebiotics in breast milk. And those cannot be digested by the infant. They're really intended to feed the beneficial gut bacteria. So if a child is breastfed versus formula fed, that does also make a difference as to what their gut microbiome looks like as babies and older kids and into adulthood.
Are there any prebiotics added to formula?
There are some formulas that do add prebiotics, but they're not the same as it's not the same, and it doesn't work the same way. A lot of prebiotics that are added to formula are just resistant starches, which is beneficial, but there's really no equal to breast milk when it comes to prebiotics in the breast milk, those oligosaccharides.
Right. And also all the nutrients that are found naturally in breast milk.
Absolutely. Yes. Yep. And so over the first year or so of life, the microbiome rapidly increases its diversity, and especially during that first year. And that's why we want to talk so much about what we can do as parents to, even though there might be a genetic predisposition or some risk factors, maybe your baby wasn't breastfed, maybe they were for a short period of time, maybe they were born by C-section, maybe there is a family history of eczema, asthma, allergies, any kind of autoimmune illness, perhaps mom or dad were on multiple rounds of antibiotics as children themselves, all of that does play a role in the risk for developing a lot of chronic issues. But that's one part of it. But the good news is that there's so much we can do as parents to mitigate these issues, especially in that first year of life, especially when it comes to what first foods you give your child.
Right. So, yeah, I mean, even a mom who's planned, let's say, a vaginal delivery, emergency C-sections happen. I certainly see a lot of dyads in my practice that, are wanting to breastfeed and potentially are not getting enough support, and it's not working for them. They're triple feeding, it's exhausting, and the mother just says, for my mental health, I cannot continue this, right? So these things happen even for moms who are educated and know, like, I want to have this happen. It doesn't always work out. So for these types of cases, what can a parent or mom do to still help support her child's microbiome that first year?
Okay, this is kind of where the most of my work lies in, and so it's prevention, but it's also treatment. And I just want to explain why it's so important to optimize gut health. There is this idea that not everyone in conventional medicine subscribes to. So if you go to your regular dermatologist or pediatrician or your regular allergist, for example, and you ask them, like, why does my child have eczema, asthma, allergies over and over and over again? They'll tell you, well, we're not really sure exactly why, but we know there's a genetic component. And so you ask, what can I do about it? You say, well, we can definitely treat the symptoms of the problem by giving your child steroids and medicines to treat the symptoms, which is a part that's very often forgotten when in conventional medicine we prescribe medicines. It's to treat the symptoms, but none of these medications actually address the root cause. So the root cause is very often a leaky gut, because the gut lining is supposed to protect your inside from your outside. That gut lining is just one cell layer thick. It's called endothelial lining. And that gut lining is responsible for absorbing the nutrients through the actual cell that is in the gut, all the nutrients that are supposed to come into your child's body so they can grow and thrive, all those building blocks. But when that gut lining starts to not have the right kinds of microbes in it, maybe there's not enough diversity, it's just not the healthiest type of microbiome, maybe there's already a bunch of inflammation from the environment, and maybe they're not able to poop properly, or they're having digestive issues as well, and there's inflammation, that gut lining starts to break apart a little bit. It's called a leaky gut. There are many different names for it. I think the most commonly used phenomenon is a leaky gut. And what that really means is, because the gut lining is a little bit more fragile, the larger molecules that are in the gut are being absorbed between cells, not through the cell, causing a very appropriate immune response, because the body sees these large molecules, whether that be foods or pollen, because we're swallowing these things as well, or dogs or cats or whatever that may be, and is mounting a very appropriate immune response, saying, this is a foreign invader, this shouldn't be here, I'm going to mount an immune response, I'm going to fight this. And what we're seeing when we're seeing all of the eczema and all of the asthma and all of the allergies is an overreactive immune system because of inflammation. And so you're kind of stuck in a spiral of just treating the symptom of the inflammation, but not addressing the root cause. That's why it's so important to focus so much on what we can control, which is optimizing gut health.
Right. So in cases where the baby is perhaps C-section born and formula fed, and now the parent's looking to introduce solids around 6 months old, that child potentially is already at risk for leaky gut and potentially having reactions to their first solids. So what can a parent do to help, I guess, even identify if their child does have a leaky gut and heal it?
Okay. So leaky gut could look like different things for different people. It's really a condition of immunity overstimulation. And very frequently, it might look like eczema, asthma, allergies that we talked about. It could also look like digestive issues. If a child is constantly having constipation or needing medications to treat constipation over and over again, a common one that's used is like Miralax. Or perhaps they really get very bloated or complaining for those older kids, like toddlers, and they're always complaining of belly pain. My belly hurts over and over again. Not just the occasional normal kind of belly discomforts, but the ones that really start to affect their livelihood, how they go about in the world. The kids who have reflux when they're little, or sometimes very serious cases of colic in infancy can be linked to a leaky gut as well. For alopecia, I believe, is also something that a healthy gut lining can start to help reverse. And I'm seeing more and more children, younger and younger, develop alopecia, which is hair loss at a younger age. And so all of that kind of comes into an autoimmune, it all falls under autoimmune phenomenon, where in older people, we're seeing things like Hashimoto's and Graves' disease and any kind of psoriasis that we're seeing in younger kids now as well. All of that is autoimmunity, when the body starts attacking itself. And the way to prevent it is not to overstimulate it over time with things in the bloodstream that shouldn't be there. The root cause is addressing that leaky gut, optimizing gut health, bringing it always back to what can we do to really reverse the problem where it began. For most kids, that's addressing the gut health. So you asked, what can we do? I guess there's no one right approach. Let me just preface by saying, and I was trying to get ready for this talk and going, well, what can everyone do? But there's no everyone. So we're all coming from different cultures, backgrounds, right? And all of that is so important, that we're still following traditional wisdom that our mothers, grandmothers, great-grandmothers have been passing down to us, because so much wisdom lies in that traditional wisdom. More recently, though, in conventional medicine, physicians and the American Academy of Pediatrics, for the longest time, have been recommending certain recommendations to mothers, going, well, if you're going to start first foods when your child is ready, and that readiness is different for all babies. They have to be able to hold up their heads. They have to be able to swallow properly. So for every child, that's a different age. And I don't think I want to talk about the age, because that's something that you really need to discuss with like your pediatrician. Is my child ready for foods in the first place?
It's very individualized. Ideally, that child's sitting unassisted.
Mm-hmm. Yeah, I agree. It's also different for whether or not your baby is breastfed or formula fed, because I really want to get formula in my practice. A formula fed baby, exclusively formula fed, I want them off that formula as soon as possible and eating foods that are whole, that are going to give them nutrients and not just chemicals mixed into even high quality formula. It's still not as nutritious foods. So, but a breastfed baby, there's a little bit more space, because we want that baby to get all those prebiotics, probiotics, and highest quality nutrients. So that timing is different as well. But in conventional medicine, very often when a child is ready for first foods, what is usually recommended is rice cereal, or like a Gerber rice cereal. Can I read the ingredients of a Gerber rice cereal to you?
Yeah.
Okay, so
read the label, parents. Read the label.
Read the label.
Just because it's recommended for your child and your baby does not mean it's healthy.
Rice cereal by Gerber. Ingredients: rice flour, so like ground up rice, soy lecithin, potassium phosphate, vitamins and minerals. I'm going to stop there. The vitamins and minerals that you might see on labels, the fortified with vitamins and minerals on labels, these vitamins and minerals are made in a lab somewhere, we don't know really, and probably not the highest quality vitamins and minerals. They're chemicals, man-made most of the time, and they're also intended they're formulations of vitamins and minerals that the body doesn't absorb the same way as eating whole foods at all. And they're used as preservatives. So I'll read that very long list to you. Calcium carbonate, iron, vitamin C, zinc sulfate, vitamin E, niacinamide, B12, B1, B6, vitamin B12, and folic acid. I don't think that should be the first foods for a baby, especially for a baby that might be prone to developing eczema, asthma, or allergies, or any other autoimmune problem, or having digestive issues. Why? Because the first foods that your baby should be eating might be the ones that actually give them those building blocks that they need to heal inside and out, those nutrients and those building blocks to heal a healthy gut, to bring them to a healthy gut lining. Another one that I found interesting was oatmeal might be recommended as a first food. Gerber oatmeal contains oat flour with wheat, potassium sorbate, calcium carbonate, vitamin C, iron, zinc, vitamin E, niacinamide, B2, B12, B1, B6, folic acid, B12. None of these should be in any child's first foods, because if they have a healthy gut lining, then they're absorbing all their nutrients properly. They don't need to be, and if a food has enough nutrient value, it doesn't need to be fortified. I find a lot of these ingredients to be extremely inflammatory, and that's what I kind of want to make this like a takeaway point. Like read your labels. Just because you're recommended to start something for your child doesn't mean that it needs to be one that is laden with chemicals.
Correct. And unfortunately, I think it is recommended because traditionally trained pediatricians do not have a nutritional background. They don't have any training around it. So, this is just what they've been taught to recommend, right? It's easy to digest. Well, is it? Not if it's a bunch of chemicals. And to your point, where is the real nutrients? Chemically manufactured vitamins are not ever going to be the same as real vitamins, right? So we really want to think about real whole foods for everybody in our family, but especially for babies' first solids.
To the point of recommendations by pediatricians, the recommendations by pediatricians are always taken from the American Academy of Pediatrics, which makes recommendations that all pediatricians have to follow using best practice guidelines. Well, I've been a pediatrician for over 10 years now, and I've seen these guidelines change dramatically over just 10 years. So for a long time, in the US, it was recommended for babies not to be exposed to anything that might be very much allergic to, like high allergen foods, like peanuts, for example. Like avoid at all costs, because that can trigger an allergic reaction. And
a severe one, like an anaphylactic one, right?
Yeah. And so these recommendations were handed down to pediatricians who were giving these recommendations to multiple generations of babies, and the amount of kids with food allergies have been skyrocketing. Okay, because let me ask you a question, moms and dads who are listening. When you were in grade school, middle school, even high school, okay, how many kids did you know in your classroom that had an anaphylactic food allergy, that had to walk around with an EpiPen, that had to stay away from nuts, dairy, from eggs, that had life-threatening and severe allergic reactions if they were exposed to any of these foods? And I bet you most of you listening would say probably none. But right now, in an average-sized classroom, about 3 to 4 kids have anaphylactic food allergies. So in like a class of like, let's say 25, that number has been skyrocketing.
It's heartbreaking.
Anaphylactic means life-threatening food allergy. So those recommendations had to change because obviously they weren't working. They were not addressing the root cause. And so recently, all the recommendations changed, and there's a lot of confusion about when to introduce high allergy foods. So right now, like, please speak to your pediatricians exactly when, but it's now they're saying, well, peanuts should actually be introduced to kids who are at risk, meaning they have like an egg allergy or a history of eczema much earlier on than over a year. as early as 4 months in some form for some kids. So my point is recommendations can flip completely, and the recommendations that you might be hearing of introduce hypoallergenic foods might not be the most appropriate for your child.
You mean hypoallergenic or highly allergenic?
Hypoallergenic, like rice cereal, they're saying like you can't really be allergic to it. So that's why it was recommended. But all of these recommendations are changing. I'm not saying don't follow it, but also use foods as your first foods that are highly nutritious, that optimize gut health in your child, that are safe. So I have like a list of foods that I use to help my patients who are of any age really reverse things like eczema, asthma, allergies, using nutrients as medicine.
Yeah, let's talk about what are these healing foods? Food as medicine.
Okay, bone broth or stocks. Okay, one of the most powerful forms of gut healing in most traditional cultures around the world use some kind of stocks or bone broths to help heal a gut lining that might be leaky, because they're so rich in amino acids like glycine, proline. I could go on and on. These are essential for gut healing and reducing inflammation on contact. Bone broths and stocks help strengthen the gut lining and really can provide a soothing effect for babies with eczema, because they're also very hydrating and anti-inflammatory. But they have to be high quality. So I am not talking about the stock that you buy in a carton that is shelf stable. I am talking about make your own chicken stock, simple, boil, use all the parts of the poultry, especially things like feet that we usually throw away. That's where all the collagens are. That's where all the amino acids are. So there is a protocol that I don't necessarily follow for a lot of my patients. It's called the GAPS protocol, but it's if you're looking to like look up recipes, a GAPS protocol, bone broths and stocks is the way to go, because that's a way that really optimizes extracting all of the nutrients from bone broths when you're cooking, and stocks.
Right. And I mean, I think some parents are like, how do I even make my own bone broth? There are a lot of companies out there now that will help you get from local farmers, get access to stock bones and these other organ or other parts of the animal that aren't maybe at your local grocery store, right?
I like to start recommending stocks because stocks are a short boil. It's like making a chicken soup, basically. You're taking a chicken, you're boiling it for like 3 hours. There's not much to it. Bone broths are a longer boil, like 18 hours. So, and you're using more
In a
bone.
crock pot.
Yeah. And I'm not a fan, and everyone hates it when I say it, but I'm not a fan of using pressure cookers to cook any of these highly nutritious healing foods, because pressure cookers denature a lot of the proteins. We actually, in medicine, for kids who are so allergic to so many different foods, the way to fix this problem where the body doesn't even recognize it as food is to use a pressure cooker to cook the food. So it's a fact. Pressure cookers do denature a lot of the healing properties of. They're easy. So pressure cookers, the ones that do really fast kind of cooking. I know there's pressure cookers and electric cookers that do slow cook. That's fine. You want it to be slow because you don't want slow. The pressure is the same as heat, high pressure destroys a lot of the healing properties. It's not bad, but it could be better by slow cooking. Most of the time when I work with families to reverse really severe cases of eczema, asthma, allergies, the bone broths and stocks are the ones that really make a biggest difference when they're done properly, when the ingredients are healthy, when they're used all the time. But how do you give this to a baby? Well, I'm not age specific, but for kids who are under 12 months, I generally don't recommend adding salt. When you do start to add salt, it has to be the kind of salt that has really high quality minerals, because that could be a really
healthy salt.
I have like two of my favorites. I know that there's better salts out there. I like Redmond's and Celtic sea salt because they're very established brands. we know very well what the mineral contents are naturally. There's no heavy metals in them. A lot of the industry surrounding Himalayan pink sea salt became so overhyped that there might not be the most healthy sources of some of these salts out there. And I do not recommend table salt with iodine for babies as well. When you do start introducing salt, pick the salt, be a consumer that really takes a look at where that salt is coming from and what's in it.
Yes, I use Redmond's and Celtic in my house, and it's for our whole family, right? Like this is something that everybody benefits from because of all of these easy to absorb real minerals that are literally from the earth that we're taking into our bodies. And I did use those salts with my baby's first foods as well. I do have a question for you for these first, like my son had bone broth as one of his first foods. And there's a little confusion for people, like, you're supposed to start one food at a time, 3 to 4 days, and then try a new food right as you're starting. And typically bone broths are traditionally made with carrots and celery and other types of vegetables that might be cooked in with the stock and the meats. But they're really cooked, right, for like hours. So would that impact a baby's reaction to, let's say, carrots, for example?
So when bone broth doesn't have to be the first food. I actually think like cooked vegetables are a great first food. Sweet potato, carrot, squash, but you don't. The goal here is actually local and seasonal. If you want to really optimize nutritional value, you want it to be a food that is local, meaning grown in the area, not in a different country, in a different part of the world, and then picked when it's not ripe, and then transported across the ocean in an environment that doesn't allow it to ripen properly, then placed in another possibly gaseous chemical environment that makes it ripen beautifully so it could be sold in the supermarket looking wonderful. The nutritional value is minuscule compared to something that is locally grown from like a local farmer's market. And if it's local, it's going to be seasonal mostly. So local and seasonal. So don't try to like go out of your way to find carrots if they're not in season where you are. Find a vegetable that has some seasonality to it. I like carrots, sweet potato, squash in general because they're really high in beta carotene. There's just a lot of vitamins that are easy to absorb. They support a healthy immune system and gut lining, and they're, yes, easy to digest. Whether you're pureeing or you're doing baby led weaning, it doesn't really matter. I think cooked and pureed is a lot easier to absorb. Cooked especially is a lot easier to absorb. I don't think you should be putting as first food things into the bone broth if they haven't had that food before, because then you won't know what they're allergic to. So I think it's really good practice to introduce a food, small amounts, and then see what happens for about 3 days. Because some reactions are not immediate, and some reactions could be rashes. It could be vomiting, right? That doesn't mean your child is completely allergic to that food if they have a reaction. That's kind of sometimes expected. It's a first food. They might not like it. They might have a reaction. Put it on hold, write it down, reintroduce it in about a month in small amounts and see if they're still having a reaction.
Right. And sometimes too with solids, they're learning how to swallow, right? So maybe some of that vomiting is more like just learning new textures and
Babies vomit. Healthy babies with no problems will vomit and spit up. But if you're seeing like really bad digestive issues, vomiting that doesn't stop, really bad rashes around the mouth, that could mean that they're sensitive to that food. It doesn't mean that they're allergic to it forever, because reintroducing it is going to help prevent these allergies, trying little bits at a time. Of course, if you're worried about your child having a really bad reaction and really severe reactions, hives, if they're lethargic, see your pediatrician, call your pediatrician right away. But for those kids who just like kind of spit it up and throw it up, try again in a couple of months.
Right. Exactly. Because it could be, it could be even if they're like, ew, I don't like this, right? Like it can be an acquired taste. And we want to have the tongue have all the different flavors, right? We don't want to just give them sweet things because then they're going to be addicted to sugar and processed foods, right? Like we want to have the sour and the tart and the other types of flavors that are available in real food.
Yeah, exactly. Yeah. There's a category of nutrients that is often kind of put on the back burner, but it's really helpful for a child who has any kind of inflammatory condition or a risk for it. It's omega-3 rich foods like cod liver oil, which can easily be given in a high quality supplement, like cod liver oil supplement. I know it sounds disgusting, but I would say most babies and young kids, they don't mind it at all. It's adults that don't like the taste of cod liver oil.
Yeah. I gave it to my son when he was an infant.
Yeah.
He didn't mind it.
Yeah, I actually, most kids don't. It's really hard to get omega-3 rich foods in a diet because things like salmon might have it, fish, but high quality fish is not easy to come by. And doing a risk benefit analysis is really important when it comes to fish and seafood. So I think that a high quality cod liver oil, like what brand do you love to recommend to your patients, Dr. Braden?
Oh God. That's a good question.
I like Rosita is a great one. It's there was a movement for fermented cod liver oil for a while, but
Oh yeah.
yeah, I remember that. But we always reevaluate our recommendations, and thank goodness there's companies that look into new supplements and what they're made out of and what's in them. And so working with a practitioner that really knows high quality supplementation, because supplements are never really the answer and they could do more harm than good if they're not high quality. So working with someone that really knows supplements well, especially in the pediatric population, is really important. So I like Rosita.
Oh, I did want to. So what's up with the fermented versus unfermented?
So they just found a lot of heavy metals in the fermented, and it just became not worth.
Oh,
Yeah. Well, speaking of ferments, fermented foods.
you love fermented foods.
Do you remember when we did a talk, a talk on ferments, and I brought my whole collection?
Yes. Dr. Nelli makes her own fermented vegetables and it's pretty impressive. And I did do that when my son was an infant. I don't do it anymore, but yes. Yes.
So
So parents can ferment their own foods.
yes, so it's a ferments are extremely powerful because for some lacto-fermented foods, meaning fruits and vegetables that were fermented just by using salt, raw, wild ferments. So you basically, I just give like a quick synopsis, okay? You take a cabbage, you shred it up, a high quality cabbage, local, seasonal, you wash it really well, you shred it, and then you put high quality salt on top of it, and you smush it all up. And so the salt pulls all the liquid out of the cabbage itself, and then you suspend it in the brine from that actual cabbage in a glass jar, any glass jar. You make sure it's all underneath. You cover it with some kind of netting so like bugs don't sit on it. You put it away. In a couple of days, I'm not going to say exactly how long because it really depends on temperature and um, uh, many other things, but in a couple of days, what that brine and that cabbage turns into is sauerkraut. And that sauerkraut, that wild fermented sauerkraut, wild because we're not adding any kind of probiotic to it, that cabbage has microbes on it that are exactly the kinds of microbes that are needed in a healthy gut lining. And that 1 tablespoon of that brine or that cabbage, which is now sauerkraut, will have about 1.5 trillion beneficial, healthy, life-giving microbes in just a tablespoon. Whereas if you go to your supplements, which are often very helpful, and you look at how many colony forming units there are. They're in the billions when you're buying a probiotic supplement. Half of it is dead, by the way, whatever you're buying. You don't even know if it's alive because it might not have been stored properly. There's a lot out there that is not high quality that you might be wasting your energy on. But if you have sauerkraut sitting in your fridge, you know that there's going to be like 1.5 trillion colony forming units, which are the microbes, in just 1 tablespoon. And you know that it's alive because it's not spoiled and it tastes delicious. And so I don't think this should be a first food, but
no, maybe like 9-10 months old, something like that.
Maybe a year. Kind of depends on what your baby's already been eating, right? Definitely about a year, you can start giving high quality ferments. This is the key to a diverse and healthy microbiome that helps support a rapidly dividing gut lining, that helps support decrease inflammation, that helps prevent leaky gut, that helps reverse chronic problems, eczema, asthma, allergies, all of those. Okay, is not just having a healthy gut lining, but making sure that the microbes that help your baby absorb all the nutrients, that help your baby detox by pooping, that help your baby stabilize and reduce inflammation, that help the immune system mature properly, because most of the immune system matures in the gut. All of those microbes have to be there. And having a baby that's had even 1 course of antibiotics can completely alter all of the microbiome that might be healthy in the gut lining, and whatever populates after that. Whatever is there will grow out.
Yeah. So what if, God forbid, a baby does need an antibiotic, because antibiotics are also life-saving? What can a parent do to help rebalance, restore that microbiome health?
I think that multiple things. I mean, making sure that they're getting the bone broths, so you're creating a gut lining that can support a healthy microbiome, right? You're giving your child the omega-3 rich foods, or in a form of supplement like a cod liver oil supplement, making sure that they're having all the nutrients, giving them fermented foods. But also, I am not against testing. Okay, like there are some really fantastic affordable direct to consumer now, meaning you don't really need to go through a pediatrician to test your child's microbiome. Tests out there that you could order yourself to see exactly what's going on. Of course, in my field, we're able to do a lot more to check what's going on. But for just kind of a prevention sake, if you're worried that your child was on antibiotics for, let's say, an ear infection or whatever it was, right? You can check, you can test, I can give you a name of like one of my favorite tests. I really like Tiny Health, and it's easy to do. It's really easy to collect, send out. The recommendations are lovely. I also find their raw data to be the most useful when I make recommendations in my practice. So the technology is phenomenal, especially for kids. It's very different for adults, but for kids, they really specialize in pediatrics and pediatric microbiomes that are very different than adults.
And up to what age?
So they do adult testing too, and they do testing for vaginal flora for women, by the way. Yeah, and I don't have a lot of experience for like the adult one because I just do pediatrics and that's all I think about. But I would say, just kind of like to deviate, what can you do? This is in your realm. What can you do before you're even expecting, is optimize your own microbiome, right? Because you're passing it on to your child. And if I could go back in time and have who's a baby all over again, she's now almost 12. If I could go back in time, I'd probably work on my own microbiome as before I even conceived, to help.
Yeah.
I mean, that's really what you can do. Pre-con so powerful.
Because you'll see, really, like, ideally that baby will have a healthier environment to develop in during the pregnancy, and then certainly the birth canal will be seeded with the best microbiome, and you're not going to see any group B strep and that healthy vaginal microbiome, right? So there's no worry about that mom needing an IV antibiotic during the birth, which then is baby's exposure to an antibiotic as well, impacting their microbiome.
Exactly. Yeah. So we kind of deviated from what first foods. I also want to
So Tiny Health does pediatrics, adult, and vaginal microbiome.
Yes.
Oh, I had no idea. I'm going to have to check them out. So that's good to know. And families know that they can get any of those tests shipped directly to their house. They get the specimen and then they ship it back to the lab.
Exactly. Yeah. And then you fill out a questionnaire. I'm not getting any, I mean, this is really my favorite. I'm not like promoting them. I don't necessarily,
you talk about them all the time in the office. So I know you love them. It's a true love.
And the technology that they're using, I'm not a big fan of a lot of direct to consumer like tests.
Sure.
They're out there. I don't like them, but this one I like because the recommendations are just, you don't really know what your child might be missing or has too much of. When you're buying a regular old probiotic in the pharmacy, you don't really know if that's the one that your child needs. And they're often very low quality. There's a way to test your probiotics, moms and dads, by the way. Everyone listening, like you could actually, if your probiotic is a powder, not like a capsule that's coated, tablet rather, that's coated, but like if it's a powder or if it's a capsule that you can open and the powder is inside, you can actually see if your probiotic is even alive by adding it to a cup of milk, leaving it on the counter overnight, and seeing if it turns into kefir or like yogurt, or does it spoil? Because if it's spoiled, it's probably dead. So I don't find most over-the-counter like pharmacy grade probiotics very helpful. And when we're recommending general probiotics as practitioners, we're kind of guessing as to what your child needs, and we don't really know because everyone's microbiomes are different. They were different antibiotic exposures, different genetics, so much. Even the difference between having a dog in the house or not makes a big difference.
Right. Pesticides very much impact the health of the gut.
Mm-hmm, absolutely. So a test like this can really tell you what kind of probiotics which direction to go, what strains, and also what foods would be recommended to focus on to feed the healthy microbes that are there or that you're trying to grow out.
That's awesome. And this can be done with an infant even below 6 months, like at any age?
Yeah, any age. Yeah, even newborns, even.
Newborns. Yeah. Mm-hmm. You can get a sample of their stool. Fascinating. Well, we have to wrap up this call. This has been so much amazing information. Do you have any last thoughts you want to share?
Yes. I know that we spoke a lot about illness, disease, chronic problems, so much we can't control as parents, but there is so much incredible information, technology, companies, supplements, solutions that you can use to easily implement into your lives without doing any kind of crazy lifestyle overhaul that make a massive impact, and an impact that helps prevent chronic problems in your kids. There's so much that could be done. I'm always feeling really, really, really hopeful about it. And I do it in my practice all the time. Sometimes it's a little bit of trial and error, but if you're starting to see these problems emerging, a baby that's having chronic rashes all the time, or a child that's always constipated, or just relying on medications over and over and over again, there are solutions that go beyond conventional medicine that are safe and effective and rooted in traditional wisdom that you can implement. So that's my final words on that.
Yes. And essentially what you're saying is the children that you do see in your practice with asthma, allergies, and eczema, they get resolution. Their body heals and they no longer have those diagnoses.
Yeah. Or I mean, yes, sometimes much improved. The goal is always higher quality of life. Sometimes the younger a child is, the easier it is to resolve these issues, by the way. And that's why I wanted to so much focus on like when you ask first foods, because they make a really big difference. You'd be surprised, moms and dads, and parents listening. So and my practice is in Dr. Braden's practice. My practice is Blossom Pediatrics. It's a holistic pediatric practice in New Jersey and in New York City.
Yes. Well, Dr. Gluzman, thank you again so much for coming on the show today. This was a pleasure. I think it was probably eye-opening for a lot of parents listening, that you know that you can feel empowered about what to do preventively, and or if your child did have some of these exposures that were not optimal, there's still a lot that can be done to help them heal and have an optimal functioning gut and body.
Thank you so much. Thank you for this podcast. You have really transformed the lives of so many people with your interviews and your wisdom and knowledge. And as a parent, I just want to say thank you.
Oh, thank you so much. Well, I hope you enjoyed hearing from Dr. Gluzman again. She is a wealth of knowledge, information, and she's so passionate about helping our children grow up optimally, healthy, happy, and well functioning. And there's a lot of ways that we can support our children in doing that. And a lot of it starts their first year of life and how their gut is developing after birth, all the way through that 1 year birthday. So I hope you got a lot of great information from today's episode. We talked about natural approaches to infant feeding, the significance of breastfeeding, the significance of the type of birth your baby had, vaginal versus cesarean, whether they received antibiotics during the birth process, and then also best first foods, introducing solids and when, and essentially what is the gut microbiome and the immune system and how that develops this first year of life. So loaded with so much great information in here. And I hope you have a lot of great pearls to take away to support your child's overall health and development.